Hello everyone, good afternoon, welcome back to Dr. Gilead Show. How is everyone doing today? Alright, this is Dr. Gilead Show and I am your host, Dr. Theo Oswala. I'm a psychiatrist and we do this show every Thursday at 1 p.m. Eastern Standard Time. Today we're going to talk about inhalant use disorders, inhalants, and we're going to talk more about it. Things people inhale. It is unbelievable. This is Dr. Gilead Show. We are on WBGR Radio. We are also on Facebook Live. You can send us a tweet. You can also write us something on Facebook and we will respond to it. You can ask a question. You can also make a contribution. Today is June 22nd, 2017. We are on Dr. Gilead Show at this time. And WBGR Radio, you can call on phone number 301-429-9247, 301-429-9247. Here you can ask a question or you can also make a contribution and we'll take your calls. Before we go, I like to always say, please do not use what you hear on this platform to make a diagnosis of yourself or make a diagnosis of someone else. It's always good to consult a doctor who can evaluate you and make the appropriate diagnosis. Dr. Gilead Show, the producers, the host, and our guests cannot be held responsible for what anyone does based on what they hear on this platform. Please always get the right diagnosis from a trained person and get the proper treatment that you need. All right, thank you. Welcome. Inhalant disorders. Now, this disorder is is a disorder resulting from use of mostly simple products that are readily available in our households. Things that we use every day in, day out, things that we use in our homes. These products are inhaled or sniffed by children, young people, our teenagers, just to get high. Now, there are many household products that are marketed that can be misused as inhalants. Inhale, you inhale something. Now, these are mostly solvents. And there are things like glues, glue, simple glue, adhesives, aerosol propellants, and even like paint thinners that are used in paints, or even gas, the fuel, the petrol that you use in driving your car. People inhale these things. That is unbelievable. So let's look at specific products that people inhale. Things like gasoline, the fuel, the unleaded fuel that you put in your gas tank. People inhale that. Is that not unbelievable? And I want to say this show is really educational. I want to use it to pass on the information to the public, to parents, so that you know when your young ones, your children, are doing some things that they should not really do. So it's important that parents will listen to this, and also family members. If you watch this, listen to it, please pass it on to family members so that they can know what our young ones could do. And you never can tell what your son, your daughter is doing. All right, so specific products that are used are things like gasoline, the fuel you put in your car, nail polish remover, the things that you use when you have your nail, your nail polished and all that, this solvent, the thing you use in dissolving the nail polish and remove it, is unbelievable. People use these this product, they inhale it. Now, even cleaning fluids, acetone, you use in cleaning your table, cleaning your countertops, your granite countertops. People use this and inhale them, sniff them. Even simple hairspray, the thing you use in spraying your hair and it smells so nice, people inhale those things. Spray paint, the simple paint that you use, it's unbelievable that people inhale those things. Fabric protector, air conditioner fluid, Freon. Freon is so expensive that it's unimaginable that someone could inhale those. This is a classical example of what people use. Even correction fluid, you remember the little whiteout that people use to white things out, clean them up? People would inhale those. Other things like lighter fluid, people who smoke cigarette, you hit your lighter and you smoke your cigarette, that lighter fluid, the fluid in it, people rip it open and inhale it. These are some of the things that our young people inhale. Now, I want you to know the active ingredient in some of these things, things like toluene, T-O-U-L-E-N-E. This is a liquid that is very light, and people inhale this. Acetone. If you go to the stores, Home Depot and Lowe's, you're going to see acetone. It's used to clean countertops. It's very light and it evaporates real quick. It cleans out, it wipes out any grease. People inhale those. Benzene and other hydrogenated carbons. So people inhale these things, and this is mostly done by young people, and it's unbelievable how old these people are. But we're going to get into that. Now, sometimes parents may be sitting in the house and your young ones, 9th graders or 10th graders, they're talking about some street names. I want you to know when they say some things, what actually that means. So they say things like glue, huff, rush, whippets. These are all street names for inhalants. And it's when you really get close, then you know probably what they're talking about. Glue, huff, rush, and all that. Now, how are these things used? They are sniffed or snorted. And sometimes they are bagged like fumes and inhaled from a plastic bag. So they can put these things in a plastic bag and put it over their head and they will inhale it. Or sometimes they are huffed. Huffed is they wrap it up in a little rag, cloth or something, or even in a sock. They take one sock and soak it in it, or even roll it in toilet paper and put it in their mouth, and it's slowly absorbed through their mouth. When they sniff this, or snort it, or huff it, as the case may be, they achieve a high. The tendency is to achieve a high. Sometimes they could also take the container, the direct container, and put it over their face and blow, sniff into it and inhale it. So these are some of the things that ways that they could directly inhale this, and that's why they are called inhalants. It is unbelievable. Now let's look at how prevalent, how common is this? How common is this this practice? How common is this addiction in our society? Now, because these inhalants, I mean, you can see it. Some of us have little cans of gasoline in our houses that we use in power our lawn mowers. They're sitting in our garages. Our young people could take them and open it up and put it across their nostrils and begin to inhale. It's very common. So because the materials that are inhaled are very common, they are legal and inexpensive, so anybody can lay hands on it. And also, because they are highly used, because they are highly available, they are cheap, nobody is even expecting it. They are used mostly by the poor people and the young people. There's no restriction. You keep gasoline in your house, you keep glue to stick some stuff together, so nobody's really watching those things. You can go to a store, to Office Depot, Staples, or anywhere to buy a glue, super glue, crazy glue, and you're not gonna. There's no restriction on sales of such products, so it's readily available. That's why it's very common. Now, it is stated that more than 22 million Americans, 22 million I say, 22 million Americans age 12 and older have used inhalants and at one point in their life or the other. 22 million young people above 12 years old have used inhalants at one point in their life. Now, and also there is about 750,000 new users every year. I mean 750,000 new users every year. Now, but the irony is, the painful thing, which is one of the reasons why I'm talking about this, is that nobody pays attention to these things. Minimal attention is paid to it, little research is gone into it, and that's why some people have termed it the forgotten epidemic. It's an epidemic that a lot of people do not even remember. We've forgotten all about it. So sometimes it's referred to as the forgotten epidemic. Now look at the statistics. 9% of U.S. population have used inhalants at one point in time or the other. 22 million people. And watch this, 13%, 13% of ninth graders to 12th graders reported using inhalants once in their lifetime, as young as a ninth grader. Now, it was also, I noticed on the statistic that about the fewer, when 12 graders were interviewed, you have fewer 12 graders reporting using it compared to 9th graders. Now you had 9.9 12 graders who have used inhalants compared to 9th graders. 15.9% of 9th graders have used it. And this suggests that those who probably were using this from 9th grade most likely dropped out of school before they got to 12th grade. And that is why you have less people in 12th grade who have used it compared to 9th graders. So people start using it as early as 9th grade. And by 12th grade, their brains are messed up and they drop out of school. It is unbelievable. It is really it is unbelievable. So that will tell you how dangerous these inhalants are. Now, when we talk about races, the Caucasians and Hispanics use more of inhalants than African Americans. 14.4% of Caucasian and Hispanics have used inhalants, while when the black people were surveyed, only about 8.5%. When you look at gender, 12 years to 17-year-olds, 3.6 males and 4.2 females have used inhalants. What does that tell us? Because inhalants are readily available, are very easily accessible, females use more. Female teenagers, young females use it more than males. Look at that statistic, 3.6% males and 4.2% females. So because they can sit in their houses, sniff it, inhale it, and nobody knows, because it's not restricted. It's not like cocaine or heroin or PCP or any of those things. That is the danger about these inhalants. It is unbelievable that people are not paying attention to this, and that is why we're talking about it on Dr. Gilead's show today. Inhalants, it is very common, and people, you can't believe this. People even inhale ammonium from feces, from poop. They go to where it is possible. In some places where they don't have the fecal drainage from the toilets, they go to the sewer and inhale it. Now, it is known that these inhalants are used more by poor people, the mentally ill, and those that are connected to the juvenile and the criminal justice system. So which means that these inhalants are used by people who already probably have some mental illness, behavioral problems, or the inhalants themselves have caused damage to the brain, making these people to be more involved in criminal activities, and they end up in juvenile jails, and or they end up in psychiatric hospitals. So these are all the things that bother me, that make me think we need to pay more attention to this, and that is why I'm talking about it today. How do these inhalants work? How do these inhalants take their effect on the people? Now, these inhalants are central nervous system depressants. They slow down the brain, the activity of the brain. They slow it down, and they depress the central nervous system. Now, what happens is when someone inhales any of these things, whether it's glue or gasoline, it goes into the nostrils, to the lungs. Once it gets into the lungs, it's quickly absorbed through the lungs and quickly transported to the brain through the blood. The effect of these inhalants appear quickly, within 5 minutes. It has hit the brain, and people begin to show the effect of these inhalants. And it's known that they can stay up to 30 minutes to several hours in the bloodstream. So the effect can last up to 30 minutes to several hours. We're going to look at the symptoms, how when people are intoxicated with inhalants, how they behave. But let's take a look at one thing. Why do people use these materials? Why do people inhale these things? Now, because it is said that within seconds of inhalation, the person experiences intoxication. They also have similar, effects that are similar to those produced by alcohol. So, remember, we're talking about things that our young ones, 9th graders to 12th graders, use. They're not legally allowed to buy alcohol from liquor stores. In some countries all over the world, people can go buy alcohol, beer, or liquor without any restrictions. But in America, where we live, you cannot. If you are below age 21, you cannot go buy alcohol. It is not allowed. It's illegal. So what happens? What is readily available can give them the high. And that's why these things are used by our young ones, our teenagers. They go, they inhale, and the intoxicating effect hits real quickly. It quickly hits the bloodstream, hits the brain, and they feel the high of like they've had a good amount of liquor. And that is one of the reasons why people use them. They are readily available. You get the high you can get from 2 40-ounce beer from a little glue. So why not use it? And it's legal anyway. And nobody will know that you drank alcohol. The smell of alcohol is not coming out in your breath. That is one of the reasons why people do it. Now let's look at the toxicology. And what I mean by toxicology is when we test the amount of substance in somebody's blood or urine. Now, inhalants are detected in the blood from about 4 to 10 hours. So if you see a patient in the emergency room, and this I want primary care physicians as well as emergency room physicians to listen to this. Once someone comes in presenting with intoxication and there's no alcohol, the right thing to do is to quickly get a blood draw and look for inhalants. Within 4 to 10 hours, you can quickly pick up what they've used. It is, but if after 10 hours, it's quickly removed from the system. But also, one problem is sometimes we may not have exactly the technical know-how to look for these inhalants in the blood, but it's still doable. So we have to be very watchful and look out for it. Now, what a question here. When someone is intoxicated with inhalants like alcohol, acetone, glue, even paint thinners, what are the things that you notice? Number one, their speech is slurred. They have slurred speech because it is a central nervous system depressant. They have slurred speech. They have difficulty coordinating their movements because imagine when you've had a lot of alcohol. That would tell you exactly how you feel when someone has inhaled some amount of an inhalant. Now, so the muscles are weak. They cannot coordinate their movements. Number two, they feel dizzy. So there's dizziness. And also they have nystagmus. Nystagmus is movement of the eyeballs. The eyeballs, it could go that way. The eyes are going. The eyeballs themselves, they go that way, or they go upwards and downwards, or side by side. This is called lateral nystagmus, or that is vertical nystagmus. These things happen, and if you really look close at the patient, you will see they have nystagmus. For emergency room physicians, when someone comes looking intoxicated and they're having nystagmus, whether it's vertical or lateral nystagmus, it is something that you need to look into quickly because it gets out of the blood system real fast as well. They have blurred vision. They may have a hard time keeping their eyes open. Some may have tremors. Tremors, they're shaking, and even their lips are quivering. They may have confusion with some amount of disorientation. Some have delirium. So they have this change in mental status. They may not know where they are. They may not know the day, the date, or the month. Sometimes we ask questions like, oh, who is the president? Or who was the president prior to this president? So these are the things that we look out for. And if you find someone who has change in mental status, then it's important that you look into it. There are other things. They may have nausea and vomiting. They're throwing up so badly, and you can't. They're not the vomiters. The thing they're throwing up doesn't smell like alcohol. So there is something that they have done. Most likely inhalants. They have inhaled something. They also feel lightheadedness. And sometimes they feel euphoria. You remember when you drink some little alcohol, have happy, excessively happy, maybe looking or talking, you feel full of yourself, feeling good for no clear reason, and people wonder, well, what's wrong with this brother? What's wrong with this young sister? They feel some euphoria. Others may have things as bad as hallucinations. They see things or hear things. Some may have delusions, especially paranoid delusions. They think somebody is watching them or following them, so they're hyperactive and doing all that. Now, in extreme cases, when they have inhaled too much at a time and too quickly, they may go into stupor and coma, and they may die. So it is a very, very serious problem. But the painful thing, it is people are not paying attention to it. So I want you to know this. Watch out for your young ones, the teenagers, boys or girls, 9th graders, even 8th graders. Look at their behavior. A sudden change in mental status, dizziness, sleepiness, drowsiness, and sometimes vomiting for no clear reason. They've not drank alcohol, and they're feeling way too happy, some euphoria. It is something that you must watch out for. You must quickly get them some help, take them to be evaluated so you can know what is going on. And you look at their activities, you can check in their school bags. Look at their rooms, you will see some telltale signs of what is going on. All right, well, I see Mr. Pepple, Harrison, Jacqueline, you all, thank you for tuning in. A viewer wrote here, he says, this is a big problem in northern Nigeria. I would like the Nigerian government to find a way of reducing this social problem among the youths in our country. So this is Mr. Pepple writing from Nigeria. We have somebody else writing from here in Maryland. It says that this is a good information to know. So we have people tuning in from all over the world, and they are listening and they are passing it on. I'd say thank you for tuning in into the show. So we're talking about inhalant use disorders. Inhalant use disorders. I also see Dr. Go calling from writing from. He says, "Hi all, we're talking about that." So they are really appreciative of the information. Thank you. Pass it on. From Canada and everywhere. Thank you. Thank you so much for tuning in. Inhalant use disorders. So let's look at how do you, as a doctor, as an emergency room physician, how would you diagnose inhalant use disorder? How would you diagnose inhalant use disorder? Now, the Diagnostic and Statistical Manual of Mental Health, 5th edition, DSM-5, talks about criteria that, if met, will give somebody a diagnosis of inhalant use disorder. And I'm going to quickly go through this. So that way we can know what we're doing. We can know when our loved one is having one of these problems. It says if the person has 2 of these criteria, if anybody meets 2 of these criteria that I'm going to talk about in the last 12 months, so in 1 year, if they have 2 of these symptoms I'm going to talk about, they meet the criteria for inhalant use disorder. Number 1, if they are taking large amounts of the inhalant, or taking inhalant over a longer period of time than they intended to. So they're taking too much, or they're taking it longer than they would have wished to. That is number 1 problem. That is classical of making a diagnosis of inhalant use disorder. Now, number 2, if they have persistent desire or unsuccessful efforts to cut back or control how much inhalant they use. And that is, for example, someone, young people like to try things. 9-year-old, someone says, hey man, take a hit. And they take a hit of glue or gasoline that pops, bought and put in the garage to power the lawnmower. And they take a sniff of it and they feel good. Whoa. They feel all high and happy and sleepy. They go get a good sleep. And they begin to do it over and over and over. And even they know that, hey, I got a problem, I need to stop. They want to stop, but they cannot stop. So they make efforts. Every time they say, I'm going to stop, I'm going to cut back, but they cannot. That is a classical symptom or criteria for inhalant use disorder. And number 3 criteria is when they spend a lot of time trying to get the inhalant. So they spend quite a lot of time trying to get the inhalant, or they spend a lot of time using it, or they spend a lot of time recovering from use of the inhalant, because these are central nervous system depressants. It wipes you out. They feel so sleepy, and they could sleep for hours. They feel so tired, muscle weakness. It's just like someone having a hangover after a huge alcohol consumption. That is what we're talking about. So they spend a lot of time trying to get it. Of course, they want to hide it from people. They also spend a lot of time using it day in and day out, or spend a lot of time recovering from the one they used before. That is classical symptom of inhalant use disorder. It's one of the criteria. Or they have a strong craving or desire to use inhalants. They sit in, they just can't stay away from it. Even from family meetings, family gatherings, they run out, they want to go look for it. That is one of the criteria to diagnose inhalant use disorder. Now, also another criteria is they're using inhalants in a fashion that results in failure to meet their obligations. Now we're talking about 9th graders, 12th graders. They are in school, so they can no longer meet their obligations. They don't do their homeworks anymore. They don't. They're failing in school, or even those that are working, they don't go to work, or at home they don't do their chores. This is one of the criteria to make a diagnosis of inhalant use disorder. Another criteria is if they're using inhalants persistently, they're using it continuously, and even though they have social or interpersonal problems from the effects of the inhalants, and that is they continue to use even though they're not doing well in school, they're having conflicts in their family, they're not meeting their obligations, and still they continue to use. Or they get into fights when they are euphoric, or they get into legal problems because they are disinhibited, they lose control, but they still continue to use. That is one of the criteria. Another criterion is if they begin to cut back on normal social or occupational activities, or even recreational activities. And for example, there are people who they used to play soccer or basketball, interact with family, hang out with grandma or siblings. But once they start using inhalants, they withdraw. All they want to do is take a hit, inhale gasoline, or run from one store to another to buy glue or to buy any of those thinners, nail polish thinners. That is another criteria. Another criteria is when they continue to use these inhalers, that even though they've noticed that it has caused physical hazard to them, it's hazardous to them, yet they continue to use it. Also, they continue to use inhalants despite knowledge or knowing that they have physical or psychological problems caused by these inhalers. They know that once I inhale, I begin to hear voices, or I act irresponsibly or irrationally. Still, they continue to use without stopping. That is one of the criteria. Or another criteria is they begin to develop tolerance, so they need an increased amount, or they need to use it more to get the same effect. So these are all the criteria. Once someone has met 2 of these criteria, they are diagnosed with inhalant use disorder. At this point, we would like to take a little break. We are on Dr. Gilead's show at this time. Please stay tuned, don't go away. We're talking about inhalant use disorder today. Let's take a little break, and we'll come back in a few minutes. Stay tuned.
You want him on the line when you come back? You want him on the line when you come back in?
No, we can. We just go back.
Okay, hold on, commercial break. Okay, hold on.
Hello guys, thank you. Welcome back to Dr. Gilead Show. Today we're talking about inhalant use disorder. We are on WBGR Radio and also we are on Facebook Live. You can call if you're local, 301-429-9247, WBGR Radio. You can also write something up to us on Dr. Theo MD, Dr. Theo Oswala MD on Facebook, and we'll take your comments. We have a caller at this time. All right, hello.
Hi. Yeah, I have a question and a quick comment. My question is, so I understand that when one of the inhalant that's most of that is widely used is gasoline. I was wondering, what is gasoline? What is worse for you, the gasoline or the combusted gasoline? Because the combusted gasoline has carbon monoxide, but the gasoline vapor itself is a more complex molecule. And actually, and also I want to know what makes these inhalants so, are they addictive? And if so, what makes them so, so attractive?
Okay.
To
All right. So well, I like to answer the second part first. So what makes inhalants so attractive is, one, inhalants give you a quick high. So what's the high people will get from, say, 40-ounce beer? A little sniff of an inhalant will get you to that level. So that's why it is more attractive to young people. You can imagine these things are readily available. For example, glue, the crazy glue that we use, or the acetone we use in cleaning stuff, readily available. Also gasoline, hey, Pop buys a little can of gasoline, keeps it in the garage to power lawnmowers. So someone inhales it, they feel good, they feel high, they feel like they've had 2 cups of liquor. And nobody knows it. There is no restriction. At a certain age, you cannot, legally you cannot buy alcohol, you can't buy from a liquor store. So what is readily available, they use it. It's cheap, very available, not restricted. And that is why it is attractive to young people. Most older people hardly use that because they can go buy beer from the liquor store. But other people, the younger ones, they don't meet the age criteria. Of course, they're going to ask for your driver's license before you buy liquor or beer from a liquor store. So that's why that's what I think it is a little bit more attractive to young people. And if you listen to the statistic that I gave, ninth graders, 14.4% use inhalants. And that is about 22.5 million Americans using these inhalants, glue, gasoline, petrol we use in driving cars, and all kinds of things. That's why I think it is more attractive, and that is possibly why young people are prone to using it. Now, but also the question about plain gasoline and combustive gasoline. When you say combustive gasoline, that means burning flame or smoke from gasoline that is burning. Is that what you mean?
Yeah, like car exhaust.
The car exhaust. So that's carbon monoxide. No, but that will kill you. When people inhale carbon monoxide, it goes into the lungs. It gets attached to the hemoglobin in our blood as carboxyhemoglobin, and that blocks oxygen intake, and people die. People get brain damage from that. So people who really want to commit suicide will do that. So the carbon monoxide from car exhaust pipes is more dangerous, is deadly. But the plain gasoline, people inhale it, and because it's a central nervous system depressant, they feel good, they feel slowed down, they feel calm, like they've drank some amount of alcohol. That's why people do that more than, I mean, I don't think anybody who wants to get high will go to a burnt carbon monoxide from a car. But also another question somebody asked is, it smells so good that these inhalants smell good. Well, of course, they are sometimes a higher level of octane or hydroxycarbons, so they smell good like alcohol. Like when alcohol is really broken down to a very fine level, it smells good, and that's why when people start using it, they continue to use it because it smells really is good and pleasing. But they get addicted to it, they get hooked onto it, and they need to take more and more to feel high. That is the problem.
Okay. And also, like another quick question: What are you said these inhalants are gasoline, for instance, is a CNS depressant.
Yes.
Do you know what parts of the brain it targets specifically?
Well, actually, it uses the pathway of GABA aminobutyric acid, GABA.
Mm-hmm.
Yes, GABA is a central nervous system depressant, and that is where alcohol uses. That is also the same pathway that things like benzodiazepines and also some sleep medications use. So it enhances GABA, which means it increases the level of GABA. GABA is a central nervous system depressant. So once GABA is increased, people's central nervous system is depressed, they fall asleep, they have slurred speech and all that. So it works through GABA mostly.
Okay, all right, thank you.
Thank you very much for calling in. So that was a very intelligent call from one of our viewers. Went into some scientific area. So thank you very much. Now, what are the effects? What are the effects of stimulants? It affects different parts of the body, just the same way alcohol affects different parts of our system. It affects the respiratory system. It depresses our breathing. It also could cause cardiac arrhythmias. And when people's respiration is depressed, what happens? They can throw up and aspirate. What they throw up, they inhale it, they breathe it in, and that can cause aspiration, and sometimes people can die. That is the danger of respiratory depression, cardiac and central nervous system depression. Now, what will happen when someone continues to use inhalants for a long time? They could have irreversible liver damage. Just the same way chronic alcohol use is toxic to the liver, chronic inhalant use is toxic to the liver. So they can have irreversible damage to our liver. It could also cause damage to the kidneys, irreversible. Even when you stop using those, they don't get better. That is a danger. It could also cause muscle damage as well as brain damage, what we call brain atrophy, decrease or loss in brain cells. If an MRI is done of people who have inhaled a lot of inhalants, it is shown that their brain has shrunken. Their brain has lost a lot of weight. A lot of the size has really decreased. Also, chronic use of inhalants can cause epilepsy, temporal lobe epilepsy, and also decrease intelligence quotient, IQ, decrease IQ. Now, it's been shown that factory workers, people who work in factories, or people who use pens and thinners, MRI and CT scan has shown a tremendous loss of brain tissue. So when you do an MRI or CT scan of their brain, you notice that their brain has really shrunken a lot. Also, inhalants can cause bronchospasm. So, what is the lesson learned there? If people who are factory workers, who work with paint or paint thinners or spray painters, even car spray painters. That's why they must use masks. There was a research done and serial CT scan of these workers were done. It was noticed that their brain mass was really decreased and was lost over time. That is a major thing that we need to work on. We need to look into it. We need to be careful. So that is a major complication. Now, what are the other major complications of inhalant use? Poor safety. Poor safety. You can imagine someone who is drunk from alcohol. What do? They have poor judgment. Poor judgment. When people have poor judgment, they take more risky behavior. When people take more risky behavior, if they drive a vehicle, they end up having motor vehicle accidents. They have motor vehicle accidents. They have all kinds of problems, relationship problems. They have, they get into conflict with family, as well as co-workers with their employees and all that. That is, those are some of the problems with inhalant use. Now, at work, they have poor work performance. They also get into violent crimes, or they become victims of crimes, because when these inhalants are done in places where they are not safe, people get raped, people get killed. We live in a dangerous world now where you can't even predict what people can do to you. So you go do this, take these inhalants in a place where you're not sure of who you are in their house, you get raped, males or females. And also, people with inhalant use disorder get into legal problems, because while they are high or they are using these inhalants, they behave in a way that is not appropriate, so they end up doing things that they are not supposed to do, and they get in trouble. So they have legal problems. And because inhalants, even though the inhalants are readily available, it could also lead to financial problems, because they miss work, or they get into other situations that money is spent. That is a major problem. Having looked at this, we can see how problematic this problem is, this situation is. It's a big problem, even though not much attention is paid to it. Why it is called the forgotten epidemic? It is a huge epidemic. In countries like Brazil, it is huge. And someone just sent a tweet that in northern Nigeria, it is a huge problem, as well as in other parts of the world. In America, 22.5 million. It is huge. It's not a joke. We need to talk about how do you treat these people? How do you manage these people? What do you do when people have this problem? So it is something that you need to take a look at to be able to help the individual who has this problem. Now, what do you do? If they come into the hospital, you need to do an urgent assessment, especially the emergency room physicians. You need to know that something is not right, something is not going on right with this person. Quickly do an emergency assessment to prevent damage, because the inhalants can really cause a problem to the body, to the brain, to the liver, to the kidneys, to the muscles. So first thing is to get a good history from the patient, but if they are belligerent, if they are semi-conscious or delirious, get a collateral information from the people who brought him, or even the ambulance, the ED people that picked him up from his house. Find out the things that they found around him or her. That will give you a lot of information on what this person probably has used. Once you get that information, then you'll be able to manage the situation. Quickly, get a blood draw. Draw the blood because you can miss the window. These substances last about 4 hours to 10 hours, if you more hours in the blood. If you don't draw the blood at that time, you miss it. So we have to quickly act, then do a physical exam. Blood draw, look at the liver, look at the kidneys, and see how well they are functioning. Also look for other substances that could be in the system of this individual. Now, it's good to also examine them for other co-occurring illnesses. Mental illness, look for other substances like alcohol, and of course heroin, with fentanyl, which is very dangerous. I may suggest that if they are unconscious or comatose, you may have to give Narcan, naloxone spray, nasal spray of Narcan. If they don't wake up, then it's not opiate use, but you would have changed the situation if possibly they were doing heroin. Now, protect them from themselves, and that is to avoid aspiration, to avoid them vomiting and inhaling their vomitus, so that they can stay alive. They can keep the airways clean, so they can breathe properly and slowly recover from what they've used. Other things to do is to quickly treat for any co-occurring psychiatric illness. But if they are unconscious or they're comatose or they're delirious, they will come out of it, but just make sure that the other things that could cause such delirious time is not there. That way they're protected, and once that happens, then you can protect them, put them in safety position so they don't throw up and inhale their vomitus. Once you've done that, they will get over it, because usually the effect lasts 30 minutes to maybe a few hours. Once the effect is gone, they will recover, they will wake up. Once they recover, the next thing to do is to treat them evaluate for any other co-occurring psychiatric problems. Because these people, they may have mood instability, things like bipolar disorder. They may have depression, and they are self-treating themselves. They are self-medicating with these inhalants. They may have a major social problem. They are unhappy, and so they have to be evaluated by a psychiatrist to make sure that they do not have other major psychiatric problems. Once that is done, they should be connected to treatment programs. They could be connected to individual substance abuse therapy. In individual substance abuse therapy, the therapist will teach them of the problems with what they are doing, the long-term and short-term effect of inhalants, the damage it could cause to their brain, their liver, and their kidneys. In individual substance treatment, therapy, or counseling, there the therapist will find out, one, why is this person using this substance? Why are they getting into this problem? How did it start? What people do they hang out with? And from there, they can work with the therapist to help one keep away from people, places, and things that will make them relapse. Once their primary mood problem or psychiatric problem is treated, they are attending individual therapy, they can stay away from these inhalants. 2, they can also attend group therapy. Group therapy is where a group of people who also use inhalants or other substances will come together and discuss their issues, how they've had this problem, why they're doing it. Some will talk about their experiences, the things they've done to stay away from it. Then the people who just started using it will learn from it and will use whatever things they've learned or they're learning in group therapy to stay away from using such substances. So individual therapy, group therapy, and even in individual therapy, you can do cognitive behavioral therapy. Sometimes people use substances to manage some issues that they have, but in cognitive behavioral therapy, they are taught on how to do it, how to manage their situations differently. It is not only the individual who uses the inhalant that is affected. Family is also affected. So you may need to get some family or family therapy, bring the family involved, bring the parents involved, bring the siblings, and they all can sit down and talk about it. Once they come together and talk about it, they will know and see what their loved one is going through, and it can help him. Once the family members know that this individual is going through through this problem, they will help them stay away. They keep away gasoline from their reach. If they're going to the stores, they will go with somebody. That way, someone can always support them, and they can stay away from using these substances. Also, there are in schools, they can monitor their attendance and also who they hang out with. Once these are all put in place, the individual will begin to do better, and also it's advisable that families will show some love. Show them love. Don't be too critical. Don't criticize too much. Don't yell at them or hit them or beat them up, because they really don't want to do it. They would rather stay clean. But they got hooked on it by trying it, either initially self-medicating, or because they are not they stopped doing what they're supposed to do. So they get hooked on it because somebody introduced them to it. Once that happens, they need every support from you, from the family, and they'll be able to stay clean and stay away from it. So they need every support, they need every love that you can give. Also, if your loved one continues to do it, you need to call for help. You can call a hotline, the substance abuse hotline, so that they can come in, evaluate, and if the patient needs to be quickly transported to the hospital, or if they have behavioral problems, they can also be taken to hospitals or units where they can get help, or referred to special clinicians who can treat these individuals. That is one of the ways that you can give them help instead of watching them go through these problems. Also, you can educate them about the dangers that this can cause, things that we talked about. It's very dangerous to continue to use these substances, so advise them not to do it. In the society, there are a lot of help out there. Once we give them the help they need, most people will stay clean. So it's a very common problem out there, even though not much attention is paid to it. But that's why we are talking about this. So I want to encourage everyone to please pass this word, forward this to different people, your friends, families, so they can listen to it and have more knowledge about inhalants, keep it away from their young ones, their children, and their friends. And that way, people do not get addicted to this anymore. It is my pleasure to have you on this program. Thank you for tuning in today on Dr. Gilead Show. Remember, we are on Facebook Live, Dr. Theo Oswala MD, 2 words, Dr. Theo, 1 word, Oswala MD, the second word, Facebook Live, also on WBGR Radio. You can download WBGR Radio on your phone and watch all the ones we've done before, including today. We are on this platform every Thursday at 1 p.m. Thank you for tuning in today. We'll see you again next week, Thursday, 1 p.m. Eastern Standard Time. Thank you for tuning in. Thank you very much. Bye-bye.